Hello, everyone, and welcome to professional development sessions on the power of effective teams and quality. My name is Nikea, and I am excited to explore how teamwork serves as a foundation for delivering high quality patient centered care. The purpose of this presentation is to help us understand why teams are essential in healthcare and what makes team high performing, and how collaboration, communication, and leadership play key roles in achieving quality outcomes. Whether you work in a clinical role, administrative support, or leadership, teamwork impacts everything we do, from patient safety and satisfaction to efficiency and staff morale. Why teams are valuable in quality improvement. Teams are at the very heart of every quality improvement effort because healthcare is inherently collaborative. No single person, no matter how skilled, can manage all aspects of health of patients' care alone. Physicians depend on nurses, nurses depend on medical assistants, and everyone relies on administrative staff to keep the process running smoothly. When a team comes together around a common goal, such as reducing hospital readmissions or improving preventive care compliance, it allows each member to contribute their unique expertise. This blend of perspective often leads to creative solutions that one individual might not have considered. For example, a team addressing medication safety might include a pharmacist to identify potential drug interactions, a nurse to share insight about how patient education, and a physician to guide treatment decisions. Together, they see the full picture rather than just one piece of it. Johnson and Scalito's 2020 emphasized that interdisciplinary teams are crucial continuous improvement because they promote accountability, communications, and shared ownership of outcome. When people feel their input matters, they become more invested in both the process and results. What makes a team high performing? Not all teams are created equal. A high performance team stands out because of how effectively its members work together towards a shared purpose. These teams are built on trust, open communication, and mutual respect. Everyone understands their role and they know how their effort connects to the larger mission of improving patient care. A high performing healthcare team also operates with clear goals and measurable outcomes. They don't just say we need to improve quality. Instead, they define how, for instance, reducing patient wait time by 20% or improving preventive screening rates by 15% within 6 months. These measurable objectives keep everyone focused and motivated. Leadership is another essential element. Effective leaders in high performance teams aren't dictators, they are facilitators. They make sure every voice is heard, encourage collaboration, and help remove barriers that prevent progress. When teams function this way, communication improves, errors decrease, and patient satisfaction rises. As Johnson Scalito 2020 pointed out, teamwork and quality improvement go hand in hand. Teams that communicate openly and learn from data can transform challenges into opportunities for better outcomes. Team processes for individual roles. Every successful team depends on well-defined processes and clear roles. In healthcare, we rely heavily on collaborations between different professions. Physicians, nurses, technicians, and administrators, all whom have unique responsibilities that must align for the system to work efficiently. When roles are clear, team members understand what's expected of them, and there's less duplication of work or confusion about accountability. For instance, if a nurse knows exactly which part of the quality project they are responsible for, such as collecting patient education data, they can focus on the task while trusting others to manage theirs. However, problems arise when communication breaks down or responsibilities overlap. A lack of clarity can lead to frustration, delays, or even safety concerns. Decision making can also become inconsistent when teams don't have structured processes in place. On the other hand, strong leadership, delegation, and consistent feedback can help teams stay organized. Ongoing training and professional development are equally important to contribute ideas. In short, when team members' roles is respected and communication flows freely, collaboration thrives. Cross-functionality and interdisciplinary collaboration. Cross-functional or interdisciplinary teams are a hallmark of high-performing organizations. These teams bring together individuals from different departments or specialties to solve complex problems. For example, improving patient discharge planning might require input from a physician, nurse, social worker, and billing coordinator. Each of these persons sees a different aspect of the process, and together they can create more comprehensive plan. The benefits of cross-functionality is that it allows for a well-rounded decision-making and helps eliminate blind spots. Administration staff might notice workflow insufficiencies that clinical staff overlook, while clinicians can provide insight into patient outcomes that administration might not fully understand. However, with the diversity comes the potential for conflict. Differences in professional background, communication styles, or perceived authority can lead to tension. A nurse might feel overshadowed by a physician decision, or administrator might focus more on policy compliance than clinical practicality. To manage this, teams must create an environment of mutual respect where everyone's contribution is valued, establishing shared goals at the start using standardized communication tools like SBAR, which is situation, background, assessment, and recommendation, and holding regular team meetings help ensure alignment. When handled effectively, across functional teamwork just doesn't reduce conflict, it turns diversity into a source of strength and innovation. Change and conflicts are inevitable in any team, especially in healthcare. When priorities shift rapidly and stress levels can be high, but these challenges don't have to be navigated negative. No, these challenges don't have to be negative. Healthy conflict, when approached respectfully, can stimulate new ideas and challenges that status quo. It forces teams to think critically and ensure that decisions are well vetted. Problems arise when conflict becomes personal or when communication shuts down. That's why leaders play a crucial role in maintaining a positive environment where disagreements are discussed openly and constructively. Similarly, adapting to change requires flexibility and trust. When teams view change as an opportunity for growth rather than a threat, they remain unified and resilient. Resources and support for continued quality improvement. Sustaining a high-performing team requires consistent support and resources from the organization. Access to data, ongoing education, and leadership development opportunities give teams the tools they need to make informed decisions. Equally important is team culture, how members treat one another, communicate, and celebrate success. Recognizing team achievement reinforces motivation and builds pride in their collective effort. Even simple gestures like acknowledging a staff member contribution during a meeting can make a significant impact. Communication platforms, mentors, programs, and dedicated time for quality improvement projects also help maintain momentum. When teams feel supported and valued, they are more likely to stay engaged and committed to the organization's mission of providing safe, effective, and compassionate care. In conclusion, effective teamwork is the foundation of quality improvement in healthcare. By fostering collaboration, defining clear roles, managing conflict, and maintaining open communication, teams can drive meaningful and long-lasting change. Every member of the healthcare team has a role in shaping patient outcomes. When we work together with purpose and respect, we are not only improve quality, we transform the entire experience. Thank you for watching this session of the Power of Effective Teams and Quality Improvement. Let's continue to build strong, high-performing teams that make a difference for our patients, colleagues, and our organization. Thank you.